With a nursing career spanning 17 years at University Hospital, Jenny excels as an educator in teaching and developing both new and experienced nurses.
When I went to college and most of my childhood, I wanted to be a teacher. I would come home and play school all the time. But when I started taking some of the classes in college, I didn't really enjoy them very much. And at that time I waited tables, and I had a friend who was in nursing school. And so she would share her experiences with me, and I was like, oh, maybe I should take a few of those courses, and I loved them.
Jenny started her nursing career as a bedside nurse in the medicine unit with a thirst for knowledge.
When I was a bedside nurse, I was fulfilled every day when I left because I had made a difference in someone's life. You know, I may have gotten there and they were in a lot of pain, and when I left, their pain was more controlled, or they were scared and now they feel more comfortable, or they finally got to go home. I felt like that was very meaningful to me.
In transitioning to the education department, Jenny was instrumental in determining her role in the department by applying her practice on a system-wide level and developing a patient care delivery process in the trauma unit.
A few years ago, we had a patient who went to the trauma resuscitation unit, and she was pregnant, 30-something weeks, and was hit by a bus, and they were able to deliver the baby and save mom, which is an amazing outcome. One of the residents who responded from OBGYN, she felt like there was a lot of room for us to improve. So I went to a conference, and some medical students had developed a overlay that you can put on the mannequin. So I learned from them how to make that and recreated it for us. And so we did several simulations where the mom comes in, you know, some sort of injury, and we have to activate OBGYN, the NICU team, and the trauma team to save mom and baby.
In 2019, Jenny completed a master's degree in nursing education, which piqued her interest in both learning methodologies and incorporating simulation activities hospital-wide to advance nursing education and practice.
Jenny provides a vast amount of knowledge and experience. You can see that she understands not only her specialty, but the various specialties that UHS presents.
As one of the primary nurse educators for University Health System, Jenny continues to bring innovative ideas and new processes. She has been able to apply her skills to develop COVID-19 mock code simulations for staff with the goal to improve nurse practice and patient outcomes.
Jenny has a great focus and a great drive at anything that she's tasked to do or anything that she wants to do. And nursing was one of those things. She believes that if she goes and does a mock code and she finds that there's tools missing, or she finds that there's communication with those teams that may not adhere to those principles, she's going to share it with somebody.
Jenny's passion continues in her role as a nurse educator. In her activities in the education department, she returns with energy to bring the ideas out as a peer and build confidence with nurses through education.
I think my biggest advice that I used to give nurses when I was a preceptor, PCC, and now as an educator is to be hungry for knowledge and to embrace the opportunities that we do have to learn more. And then the other thing I would say is take time for yourself. There's some culture in nursing that we're tough, and we are, but it's okay to say, you know, today was a tough day, or, you know, you have a patient who doesn't do well, it's okay for you to say, you know, I need a few minutes to collect myself. And I think us looking at each other and making sure that we're all safe, not only clinically, but then also emotionally, is really important.